Sorry if you're watching the circle of death was just happening. Going live, and bam, there it is. So here I am. All right. What if healthcare before 65 is not this big, giant monster boogeyman we have all thought it was? I know I thought it was. I thought healthcare was going to derail any thoughts of retiring early and leaving my current job or any job that provided health coverage. Because we've all heard how expensive it is. It's in the news all the time. How the heck are we going to afford this unless somebody is subsidizing it or paying for it? Came to find out, healthcare is not the reason that's keeping me stuck. It should not keep you stuck in a job you're ready to leave, especially if this is your life's last job. It's your fear, your confusion, and for me, my absolute ignorance of what healthcare actually costs. This week, this 7-day series has been you walking through what I have walked through as I tell you about the things that I've learned in the different categories that I've learned them. This was not me becoming an expert on healthcare or healthcare cost. Far from it. It was just myself teaching my investigation, things that I thought were, wow, did you guys know that? This isn't going to make you an expert either, but hopefully it will give you enough information for you to realize that you don't have to be afraid of it. You are capable of figuring it out and understanding it. And by God, you do not have to stay working until age 65 because that's the age they tell you you can convert from private pay insurance into Medicare. Medicare is going to be great when it gets here, but it's not here before age 65. So if you're done working for somebody else, if you've just got to, and for me, it's a must have, I must transition into this next chapter sooner than later. So, healthcare for me, no longer the boogeyman, very affordable, considering what I thought it was going to cost. Most of us, we've grown up listening at the knee of our parents or our grandparents or our great aunt so and so, listening to all of the reports that we consume on social media about the horror stories of healthcare insurance gone crazy, how it's way expensive, and if you don't have it, you're going to lose everything. And a lot of it has some kernels of truth. Most urban legends do, but the majority of it is just sensational BS to put fear into us that we allow. I don't think they're intentionally trying to make us afraid of retiring early and getting our own health care. But if you're looking for an excuse, in my family, my dad had a saying, axe broke, can't make soup, which means when you're looking for an excuse to not have to do something or to make a decision, one thing is as good as the other. And for me, because I wasn't fully ready to think about or prepare mentally and emotionally to make this next step into the next chapter of my life, axe broke, can't make stew. Oh, healthcare, I can't afford it. It's too much. The reality is, I was wrong. And I think you're going to find out you were too. And not only do we have to learn that healthcare is not this huge amount that we can't manage because it's not as big as you make it out to believe. But we also need to have a better working knowledge of how it works. So for me, healthcare, and for the series, as I'm talking with y'all, it's not just healthcare is your insurance premiums. No, no, ma'am. It is your insurance premiums, whether it's monthly, quarterly, 6 months, annually, however you arrange to pay it. But it's not just that. It is your deductible. It is your copays. These are things that are part of the foundation of any healthcare plan that you're going to have to select. So you're going to have to figure out where you're comfortable. Just like when you shop for homeowners insurance or car insurance, they say, well, how much of a deductible you want? The higher your deductible, the lower your premiums. But be careful with that because We have a life history of not making 100% great choices when it comes to our health. We also have genetics that may or may not be on our side, and we got a lot of years left in front of us. So when you're shopping, make sure if you're shopping based on the deductible amount, that that's an amount of money you can afford out of pocket before the insurance kicks in, because that's how that works. Copays, it's pretty similar. The specialist, etc., pre-existing conditions can sometimes price you up or price you down. Usually price you up, especially if you're not going to the ACA, the Obamacare exchange, or going to go to a private insurance provider. These pre-existing conditions can also raise your cost out of pocket. Things for you to become more clear on and better educated on. But here is the kicker. It's not just all of that. It's your prescriptions. And these are things that doctors actually write you, that you go to your drugstore or you get through your mail order pharmacy and you figure out, well, you don't even have to figure it out, you just get them filled. And some of us have been doing this blindly without a second thought our entire lives. We have reached a point in our lives that if we are ready to lay down a regular paycheck, especially before we collect Social Security, before 59 and a half, where we can start pulling out of our retirement funds without penalties, still pay taxes, but without penalties, you need to start evaluating what your healthcare cost is overall. So, your prescriptions. I personally have always insisted my doctors provide me a prescription for a medicine that is not one of these first generations that are going to cost me the firstborn plus 3 kidneys to be able to afford, even with insurance. I have been a contractor most of my working career, which means if I am lucky to have employer agency provided health insurance, that's a blessing. A lot of times I've had to carry my own health insurance. So you get real sensitive to the cost of prescriptions, because prescription coverage is not always baked into the policy you're purchasing. So make sure you're looking into that as well. But you can help manage your prescription costs by having the conversations with your healthcare team. You have me on this. Is there a generic equivalent you'd be comfortable with letting me take? And if so, then put me on it. My prescriptions, all but one, I can walk into any pharmacy, get the generic, and have a monthly out of pocket of less than about $20. I want that for you. Now, depending on what your medicine cabinet looks like with your different prescriptions, you're going to have to figure this out with your healthcare provider. So don't make these decisions on your own. This is where you sit down with them or you ask questions through the portal, but you've got to rely on them to do the best for you. But you encouraging them, I'm not made of $1 million. I want to leave this job. What ways can you help me save money? You'll be surprised at how willing they are to help you save money. And here comes the one that really surprised me. And I'm hearing in the comments from a lot of you that you've done the same exercise, whether after I told you to or because you're smarter than the average bear. These supplements we put ourselves on. I sit down, I travel a lot, so I have all of my morning and afternoon or morning and evening pills, and I'm on like maybe 3 total prescriptions, but I would have a fistful of various things that I would have to swallow every morning and afternoon. And I sat down and it's like, what am I doing? I have 3 tiny itty bitty flea-sized pills in my prescriptions, maybe one that's a little bit larger. But the rest of them, what is this? So I plugged them all into a spreadsheet because you know me, I'm a spreadsheet girl. I love that. I plugged them all into a spreadsheet. This is what I'm taking. This is how much the bottle cost. This is how many doses. So this is how much per dose. So this is how much per day. Then I multiply that by 28 or 30, however you look at a month. And I was spending over $250 a month on self-required supplements. That got my attention. I then plugged it into my AI engine. I use ChatGPT, not sponsored, but love it. I don't know which one you use or if any. You can do it the hard way if you want to and actually list out all the ingredients, et cetera, et cetera. But I just took pictures of all the bottles and what they contain, and it spit me back at an analysis because AI is great for that. Of you're doing this much in redundancy, you've got this much. Oh, let's see what a clean family phrase is. You're taking a lot of stuff that I have bogus claims. We'll call it that. I have other more colorful things to say for these claims, but they're bogus claims. There is no medical research or anything that backs up that it's actually going to do what it says it's going to do. But it also gave me props and kudos that based on what I know of your medical history, this is what is actually doing you good. When it comes to fish oil, I was taking this fish oil versus a much more affordable fish oil. And it turns out the much more affordable fish oil was better for me. Plus, it was a third of the cost. You need to look at that and include this in your overall health cost numbers. Now, I know this is a lot to unpack. It was a lot to unpack for me. I'm still not fully there as far as putting it all down on paper into a understandable format that will lend itself for me to sit down with my husband and actually talk it over. So what I'm doing is I am actually creating a workbook for me, just like the retirement reality reset kit. But this one is about healthcare cost. And this one, let me tell you the name of it. I actually did leave it open. I've been working on it all morning. It is Healthcare Before Medicare Survival Kit. Clever, isn't it? How to leave your job without panicking about healthcare cost. This will be out soon. I will post it in the chat for the community, and then I'll also start appearing in some of my videos. But definitely grab that. There'll be a corresponding spreadsheet so you can just plug all this into it, including a supplement comparison analyzation spreadsheet. So you guys be on the lookout for that. But clarity in all of this when it comes to what healthcare actually costs, what it entails, ways that I can proactively be my own best advocate, reduce my prescription cost. And you can go ahead and do that now. You don't have to wait until you're on your own health insurance policy. You may not have prescription insurance that's picking up everything that it could, especially if it was a generic. So why not go ahead and have those conversations as if you're preparing for the exit? Because ultimately, we're all going to exit. So if this is a long-term maintenance medication for you, have those conversations with your doctors. Go ahead and make the transition so there's less on your to-do list when you finally do decide to make the jump. Let's see. Healthcare stuff. Oh, yeah. I've covered all the supplements. I've covered prescriptions versus generics. Something else to be aware of. Had a doctor once that refused to write me generic prescriptions. Now, he was a doctor for a season, not for a long term. There was certain specific things I'd been referred to him for. So he said, absolutely not, because the name brands have 100% of the active ingredient that I need, where the generics, by law, only has to have a certain percentage of the active ingredient. Thus, the reason they're less money. That's all right. I can respect that. You want me to have 100% benefit of whatever this manufactured chemical is? Done. But that's not always the case with other generics. So make sure you have that conversation. And I have just gone all the way back in my slide deck. Let's see. So understand your policy also. We've touched briefly on not a lot of us fully comprehend how health insurance works. So there's the premium, there's the maximum, they're out of pocket, there's your deductible, but there's also in network versus out of network. And when you start making your selection for your personal paid policy before 65, and then after 65 too, let's just go ahead and put this out there. A lot of what you're learning now will serve you when you go into the 65 Medicare transition and you have to select policies then. You already know this stuff. A lot of my seniors, when I have held their hands, and by seniors, I mean parents and in laws and friends, as they've moved into making the Medicare selection those first couple of times, or when I had to do it for my mother, when I took over her care and feeding post her husband's demise, those were learning curves to figure out in the weeds, on your feet, with a very finite timeline to make a selection, how all of that works. So you're learning it now, so you're setting yourself up for much better success at age 65. But understand your policy before emergencies happen. Just as you know, with your homeowner's insurance and our hurricane, I'm in the South on the Gulf Coast. This is where I grew up, so I'm very familiar with OMG, the hurricane's coming. Honey, where's the insurance policy? Back in 1979, there was a hurricane named Frederick that was coming into Mobile, Alabama. And I think I was in fourth grade, and Dad was loading all of us up into the Winnebago, and we were going to run like heck in front of it to get out and away from this terrifying hurricane. So they grabbed all the personal papers they could think of. They threw all of us in it and off to Georgia, somewhere we went. Part of the papers that they collected was the homeowner's insurance, only to find out that 3 weeks ago, at this point in 1979, the annual amount was due and the check was still in my mother's purse. It had never gotten mailed. So that was an additional fearful point. And that's just a side note. You guys enjoy that story. You're welcome. Okay, but with your health insurance policy, just like your homeowners, you want to make sure you pay your premiums. There we go. There's the moral of that story. Make sure you pay your premiums, but also understand where you're to go in case of an emergency. So if you live at 123 any street in any town, USA, and you and or your spouse or life partner, whomever you label your love with, then when something happens, when they fall off a ladder or there's a kitchen accident with one of those mandolin things and somebody shaves off the fingertip, what emergency clinic are you taking them to? Do you take them to a clinic or you take them to an emergency room? If they wake up in the middle of the night with a horrible fever and you can't handle them into the car to get them somewhere and you need to call an ambulance service, which one are you going to call? And which hospital are you going to tell them you have to go to? Found that out the hard way. You can't just call 911, get any ambulance service to come to your immediate need and have them transport you to your hospital of choice. That was a big, what do you mean with my mother after her husband died? What do you mean we can't take her to the hospital she's accustomed to? Well, because you're in this zip code and we have to take you over here. You don't get a do over in that situation. You can't then go call an ambulance service that will take you to the right hospital. So, know your policy. Go ahead, walk through, because you're not going to have a company HR. You're not going to have a dozen coworkers who all use the same policy for you to rely on to help walk you through these things. This is ultra adulting. You've got to be sure you're on top of this. So, talk